There aren't that many examples in American history where citizens are able to fundamentally transform the most powerful country on earth.
I have a dream today.
There are a broader set of issues that have to do with the economy and economic opportunity and the continuing barriers that African Americans, Hispanics, and increasingly, working class whites have in terms of living out the American dream, being able to get a job that pays a decent wage and having health care and making sure that their kids can get the education they need to compete.
Because health, education, and the economy are integrally linked.
The idea that you could do everything, quote unquote, right, save money, stay out of trouble, educate yourself and your kids, and you can still end up in a precarious and even perhaps degrading condition.
48 million Americans are just low-income Americans, and poverty really doesn't discriminate.
These are some of America's poorest adults, as well as many low-income children, seniors, and families that work for low wages.
They experience in a very personal way a dangerous and growing inequality and lack of upward mobility that has jeopardized middle-class America's basic bargain. That if you work hard, you have a chance to get ahead.
A new analysis by the Associated Press finds that budget cuts imposed this year under sequestration promise to be far more painful in 2014. The cuts now in place will remain in effect for the next 8 years unless Congress acts to change them. Federal funding for food stamps alone could face a nearly $10 billion reduction over the next decade as part of a compromise bill to break a House-Senate deadlock on spending. All of this follows the so-called Great Recession, which began in 2007 as the longest, deepest economic downturn since the Great Depression of the 30s. Meanwhile, income inequality is at levels not seen since just before the 1929 Wall Street crash.
Wake up. Step 1. Recognize the truth. Everything is connected. Health, education, and the economy, just like mind, body, and spirit. Consider the following. Holistic care has been proven to yield the best outcomes in the least amount of time for the lowest cost. Similarly, healthy kids learn faster and better, consume less costly healthcare, and are far more productive over their lifetimes, which is good for the child, the family, the community, local employers, and even the economy. Step 2. Recognize that the biggest priorities that our nation has as it relates to reform are also connected. We're talking about health, education, senior and social services, and community development. Step 3. Recognize that the fastest growing and most costly state budget line items are directly connected to the fastest growing and most costly healthcare consumers. We're talking about poor seniors with multiple chronic diseases and at-risk youth, which grow up to be aging inmates, which are the most costly healthcare consumers because they've got chronic disease prevalence 3 to 4 times higher than the general population, and healthcare for inmates can cost as much as 15 times more in prisons than it costs in the public domain. We have 3 pilots designed to meet the needs of the whole person, mind, body, and spirit. We start with school-aged children simply because they are our future. At the same time, schools are in every community across the nation, with treating the needs of children of all faiths and walks of life. So Pilot A is geared towards meeting the physical, mental, and psychosocial support services that are needed for our children to be at their academic best. Pilot B is geared towards faith-based organizations simply because they provide the overwhelming majority of charity care for vulnerable populations. such as our seniors with multiple chronic diseases and cancers that are bankrupting our healthcare system. Pilot C is geared towards the sandwich generation who have to balance conflicting priorities, such as those of their ailing parents and their school-aged kids. By meeting the needs of our most costly and important healthcare consumers and providers and facilitators, we can actually improve compliance with self-care and discharge instructions, which reduces the likelihood of complications, ER visits, and costly readmissions. It's in this way that we can reduce healthcare costs reliably, sustainably, compassionately, and with an eye towards the future, because we honor all participants in the patient-centered care team, which allows us to easily migrate from a volume-based healthcare delivery system to a value-based healthcare delivery system, where we compensate people by monitoring and managing outcomes over time. Since no one trusts the government and no one trusts big corporations to manage our health information, it makes sense that we have a public-private partnership, a watchdog group, to manage all of our data that's owned and operated by we the people and accountable to no one other than us, the 99%. This is the kind of change we can believe in because our solution is designed to be 100% self-sustaining after the first year of operation, which means that every job and small business that's created as a result of our health reform solution will improve the health and economic vitality, not only of families, but entire communities, counties, school districts, and states. This is change we can believe in. There are 5 basic components of the firestorm, which is the public alternative. Its purpose is to transform the public health safety net from the bottom up and from the inside out for good. 1. The firestorm. What is it? The firestorm is the movement that gets it all going. It's comprised of a public health and social safety net support service that includes community outreach, job creation, and health ministry support. 2. Fire stations. Fire stations are participating faith and community-based organizations that use fires to improve the health status of their members and congregations. 3. The FireSafe Information Exchange is a federally sanctioned, secure, and compliant electronic medical record and reporting service that lays the foundation for easy, ongoing cost-benefit analysis and enforceable accountability. 4. The Fire Safety Net. Fire stations and providers create a holistic medical home that connects patients, caregivers, and providers across separate domains. Finally, the Fire Safety Net plan provides local access to affordable care from any participating fire-powered facility, whether it's a fire station, clinic, or participating provider.
I think there's some underestimation of what happens at the grassroots when you're trying to create transformational behavior. And I just want that to be on the record. Thank you.
We can do that.